all for being here. I'm excited to host this event. Just a little thank you to all of our table manners, clients, and friends. This is Sally. Sally is a functional medicine coach who I've been working with. And when I started learning things that she was teaching me about my blood work and functional health and supplements, I was like, okay, the problem is no. And so I had this idea for a while. I wanted to have this kind of event and have her come teach us. I wanted to read her official bio for you. So Sally Sykes, she's the founder of Empower Health Consultants, a passionate advocate for empowering patients to address root causes of their symptoms and take control of their health. A cum laude graduate of Georgetown University and a holder of a JD/MPA with 2 lowercase steps. What does that mean?
Public Affairs, Master of Public Affairs. LBJ School, Las Vegas.
Okay, from University of Texas, Austin. She transitioned from her career in Illinois to functional medicine after losing her father to Alzheimer's disease and reversing her own type 2 diabetes. With 15 years of experience as a functional medicine health coach, Sally specializes in optimizing health through personalized lab analysis and working with clients to prevent chronic disease. Her expertise spans insulin resistance, weight loss, hormones, thyroid, autoimmunity, cognition, energy, libido, and more.
I'm not afraid.
Sally helped me discover that I have Hashimoto's, which is a thyroid issue. So I would never know that one autoimmune disease can lead to others. So thankfully we don't have. Now I have a thyroid specialist, and Sally has been taking 30 supplements. Yeah, it's been really great working with her. I'm so excited for y'all to work with her. Lastly, I want to thank our sponsors, BDJ. Thank you for the linens. Monica picked these, so Megan said just bring whatever you want. So these are super fun. Part of the Moon Tower, thank you for the furniture. Wild Bunches, thank you for the beautiful florals. They're always ready and willing to help. Bernie Homestead, Julia, thanks for letting us use your space. Perfect for today. Good to see you. Thank you for being here and meeting us. It's wonderful food, cocktails. Moon Tower Entertainment. Thank you guys. And Tim Yans, of course, sponsor everyone. Yes. Megan, ready to send out texting questions? Okay. It's on here. Oh, yeah. So during Q&A, you can text questions. Megan's phone number's on here so that they're anonymous. Well, they won't be anonymous to her if she knows who you are, but it's anonymous. Oh, it's Sally's number. Oh, great.
Which number did you do? Is it 2329?
Yeah.
Okay, and let me get that. Oh, that's going to be on. All right, you know what? I'm going to be recording with that phone. All right. You guys, this is a small enough group. Y'all can just ask me questions, right? Yeah, just raise your hand. Yeah. Okay. All right. I think we could do that. We're going to have a little like coffee talk. And okay.
A private question, you can ask me and I'll ask it. I'm not embarrassed.
Or you can grab me after, because we're going to have question and answer, and I'm going to have private time with whoever brought labs so we can analyze things. So that's another chance to ask something. But yeah, I'm not afraid to answer anything.
Yeah. And lastly, thank you, Megan, for planning this. Such a beautiful job. So that's what makes it so easy. And I know Sarah helped with some of this too. Our team leader, Sarah. So you guys know them and love them. All right, let's jump in.
Thank you. You guys, I made copies. Y'all, copies are so expensive. I spent like $200 making 45 copies out of the beginning of my slideshow. Now you guys have like a beautiful aesthetic summary of it. But if you're one of those people, maybe your eyes aren't so good and you have a hard time seeing this, or you just want to follow along the slideshow, let me know and Megan will hand out my very expensive copies that I have. So is anybody, raise your hand if you want a copy of the slideshow? Anybody? Okay, oh, perfect. Awesome. Start with that. Give like 5 copies to each one, and then more room to take notes and everything. Oh, I'm so excited about this. This is the time of year where we're all just kind of doing a reset. I analyze labs for a living in my coaching practice using optimal ranges. And this is the time of year where I always see everybody's labs just go haywire. So if this is you and you just got your labs done or just had a physical and your triglycerides and blood sugar and everything is off, don't worry, it usually gets better. And with everything you're going to learn today, you're going to know how to make it better, especially the metabolic labs. So how not to die. I thought that would be dramatic. But really, it's how to live your best life, right? We don't want to live to 100 if we're going to be infirm from age 60 to 100. We want to have good lifespan and good health span. If you've ever heard Dr. Mark Hyman or any of the functional medicine doctors talking about that, you want to actually have good years that are healthy and that you're not just in a nursing home. Brooke did a great job introducing me. I'm Sally Sykes. I was a former attorney turned functional medicine health coach. So when my dad was diagnosed with Alzheimer's disease, it was a real wake-up call. He was very young. He was dead by 67. And if anybody have Alzheimer's in their family and know somebody with Alzheimer's, yeah, y'all, it's the worst. I know cancer is terrible, but for me personally, I'd rather have cancer than Alzheimer's because you just lose yourself and you're a burden on your family. And that's exactly how it was. He was gone 10 years before he was gone. So I start looking into what are the causes of Alzheimer's disease. There's no cure. Once you have it, once your brain is damaged, that's it. And I found a book called The End of Alzheimer's by Dr. Dale Bredesen. And in it, he has this list of labs. He says there's like 100 things that cause Alzheimer's. So we want to optimize all of them. So he has his list of labs and optimal ranges for those labs that he wants you to be in to prevent Alzheimer's. And I was like, what is this optimal range? Like, I know what normal range is when I get my labs done, right? And he's like, no. Those are just the averages of all the sick people, right? You're not getting thyroid labs done when you're feeling great. Of all the sick people getting those labs done at that lab. So normal ranges are going to vary by lab. They vary by year, by part of the country, and they do not correlate very well to disease prevention and good health. Optimal ranges is what functional medicine uses. And those are much more correlated with disease prevention and good health and actually how you feel. So who has gone to the doctor with a load of symptoms? I can't lose weight, I'm losing hair, I have no libido, I'm exhausted all the time, and your labs are normal. Anybody had that? You're normal? I guess it's all in your head, right? Especially if you're a woman, we get told it's all in your head. That's called medical gaslighting. And that's what yeah, exactly. And that is what normal ranges lead to. And that's why I love optimal ranges, because we find things like with Brooke, might be normal for you to have a sick thyroid, but it's not optimal. You're going to be so much better if you do. Around the time of my dad's diagnosis, found out I had type 2 diabetes. I would eat a piece of fruit and my blood sugar would go to 250. I was on all kinds of medications, you guys. I was on the birth control pill. I was on IBS medicines. I was on Adderall and Zoloft and just you name it. And none of it was helping me. So I went low carb, learned how to reverse my type 2 diabetes. Just by doing that, I got back to my high school weight, like pretty quickly. I used to be about 40 pounds heavier, and it was all here. This is the carb insulin resistance belly. And it was really eye-opening to me. I don't need to take all of these other medications. We're going to talk about this, but when people say they don't want to be on meds, I agree with that. I don't want to be on meds too either. But in functional medicine, we look at it a little bit differently, right? The vast majority of the pharmaceuticals we're looking at are what I call Band-Aid medicines, where you're just covering up symptoms. You're not actually treating the root cause. And then on the other side, we have things like estradiol, progesterone, testosterone, thyroid hormone replacement. We're replacing, and GLP-1. We make GLP-1 in our own bodies. We are replacing the same molecule that our bodies normally make, as opposed to covering it up, right? If we can't lose weight, we don't have a phentermine or a speed deficiency, right? That's a medication they'll give for weight loss. It's just speed. But we probably have a GLP-1 deficiency. That's been documented in studies. So that's a little bit of a difference. I started with functional fertility, helping women get pregnant just by teaching them about their bodies. This is how you take your temperature every day. This is when you ovulate, have sex then. But they had been already kind of brought into the IVF, like industrial complex. And then they were, all three of them, able to get pregnant within 3 months without having to do IVF. And I got really interested in the education and the empowerment part. I feel like, especially women, we are just not told all of the things that we can do and how our bodies work. And we're not supported. We're told it's all in our head. And what you're going to learn today, how to read your basic metabolic labs like a pro. Now, these metabolic labs, yes, these are the same ones that we track for weight loss patients. I work with different practices running their GLP-1 weight loss programs like Ozempic, Wegovy, Zepbound, Mounjaro. But these are for heart disease prevention, for diabetes prevention. It's all connected. So you're going to prevent heart disease, dementia, diabetes, but you're going to lose weight in the process or optimize your weight, whatever your goal is. What optimal means, we talked about this already. Optimal range is going to be the best spot for disease prevention and feeling your best. That's where you feel your best, as opposed to what is normal or average, the average sick American. You're going to learn how inflammation, insulin, and blood sugar affect your health and weight, and what you can do now to stay sharp and strong and out of the nursing home. Does anyone follow Dr. Mary Claire Haver on Instagram or any of the menopause? Everybody know what the yes, I know, I love them. So it's Dr. Mary Claire Haver, follow her. Dr. Kelly Casperson, like Casper the Friendly Ghost. I love Kelly Casperson so much. She is so positive, amazing content about hormones. And then Dr. Rachel Rubin, that's the menopause. Love them. They talk about the nursing home prevention program. It's lifting weights, nutrient density, replacing hormones, all of that. And then why overweight, obesity, heart disease, dementia, diabetes, and even cancer share one root cause and what you can do about it. And then afterwards, if you brought your labs and you signed up for a spot, or even if you didn't sign up for a spot, I think we have time, I can do one-on-one lab reviews with you guys, especially if you want it to be private, or in the Q&A, you can just say, when I've done this before, people are like, well, my glucose is this, what does that mean? I'm like, perfect, you can do that. It's up to you if you want it to be in front of people. So what is functional medicine? So I grew up in a family of doctors from San Antonio, super snobby, you guys, like we poo-poo chiropractic and da-da-da. You know, functional medicine, discovering it, people ask me all the time what it is. Isn't that just woo-woo? Isn't that just like you're doing supplements instead of real medicine? Functional medicine is real medicine. Most of the functional medicine practitioners you'll see are MDs, but they've gone back for additional training because they got sick of their patients just not getting well. And so they wanted to learn more about root cause medicine. Like, how do you actually do this? Like, your patient is not sleeping, they're anxious, they don't have a Xanax or Ambien deficiency. It's a 40-year-old woman, she probably has a progesterone deficiency, right? That's nature's Xanax. So very different outcomes, right? So conventional medicine, y'all, is amazing for acute care. If I'm in a car wreck, I don't need somebody giving me vitamin D, right? I need somebody to put my body back together. We love it for that. You know, getting COVID and the antivirals, that's wonderful. But chronic diseases is what kills most of us. The chronic diseases of aging, it's going to be heart disease, number one, kills more people than all cancers combined. So chronic disease is not so much like autoimmune disease, but most people don't die of emergencies or cancer, they die of preventable chronic disease. So functional medicine focuses on finding and treating the actual root cause and not on Band-Aid medications that are just covering up symptoms, right? So for inflammation, like a lot of women my age have frozen shoulder. I'm 52, it's like a whole thing. It's just due to lack of estrogen. My mom, who was a baby boomer, was not even given hormones. Her whole entire body is immobile with arthritis at this point from the loss of estrogen. And my shoulder started to do that, and I got enough estrogen. I have to go to enough doctors to get enough so that my shoulders will move, and I can put on my bra and put on, if you haven't had frozen shoulder, y'all are all probably younger than me. It's terrible. You can't even do your dress. But yeah, I didn't need a shoulder replacement. I didn't need cortisone shots in my shoulder like my mom got, because when you get those, it actually weakens the internal structure of your shoulder. I needed estrogen, just what my body had in my youth. And so that's it. It's so much easier to prevent disease in the first place than trying to reverse it on the back end. So this is what I love what I do, because I get to help you guys catch things early. It is so much easier. You know, I work with people who are a little more far gone, and that's fine. But when we get somebody who is just 10 pounds to lose and they have a little bit of prediabetes, boy, you put them on a tiny bit of a GLP-1 and they are within a few months reversed. But there's plans for everybody. Even if it takes a few years to reverse, I mean, we were all here, like it took me 40 years to become type 2 diabetic, eating the way the American government told us to. We were told, right? The food pyramid. They eat all the bread, pasta, cereal, crackers, waffles, fat-free this, fat-free that. Don't eat bacon, don't eat avocados. And my sisters and I are all diabetic. And so much easier to prevent on the back end. And now is the time to do it. Bless you. Normal versus optimal. You're being told you're normal when you feel like garbage, or you just know you're not operating at your highest level. I think you guys, if anybody, I would say you're probably all super type A, operating at a very high level. And sometimes you probably think, well, I'm doing great. But what you probably don't realize is how good you could feel, right? So if some of these labs that we talk about are a little off, I hear this all the time. Like, I had no idea I was tired all the time. I had no idea that my sleep was off. I had no idea my libido wasn't as good as it could have been. When we start to fix these things, you're like, oh gosh, my potential was way up here. And I had gotten used to this certain level of feeling of the fatigue. I talked about the normal ranges. They're just the average sick American ranges, optimal ranges for feeling your best, and medical gaslighting. You deserve optimal, not normal. Y'all are not normal. Y'all are baddies. I don't know how you do what you do, seriously. I mean, just the amount of work that goes in. I just got married in November, and we would have been lost without our wedding planner. The amount of work that she did, it was nonstop. Y'all are nonstop with this, and the creativity. I'm so impressed. So how we die, heart disease is the #1 cause of death. Men's lifetime risk is about 60%, women's is about 56%. The root cause of heart disease is not fat or meat, it's inflammation. The root cause of inflammation is insulin resistance. What's the root cause of insulin resistance? Excess carbohydrate consumption, sugar. Yes, exactly. Just us. We got it. Right. So we've been told it's a fat. So Dr. Mark Hyman says, we'll get there. I have insulin. How we die. There we go. Dr. Mark Hyman likes to say, don't blame fat and salt for what sugar and starch did. And that's so true. It's so true. So we have a lot more control than we think. And y'all, it's really fun to eat this way. Do you know how much I love bacon? And now I'm having bacon again. It's high in serine, which is great for your brain, and then no carbs. And to be able to just eat meat, I was anemic my whole life. Well, of course, I was eating the food pyramid. Like, I thought that was healthy whole grains, but it's no nutrient density in that stuff. Bread, pasta, cereal, crackers, waffles. It's inflammatory. You're not giving your body the nutrients it needs, so it's just starving all the time. When that's that high carb diet, it's spiking your insulin. When insulin makes you starving, so you're like, why am I like an empty pit? This is me. I had at one point, I don't know if this just goes to type 2 diabetes, but I was never ever full. And I had cake frosting hidden in my bathroom. It was an addiction. And some people are like, oh, I'm not a sweet tooth. I'm more like chips. I'm like, okay, so you have chips hidden in your bathroom, like whatever it is. But it was, if you were to tick off all of the addictive, if they're asking you, if you're in residential treatment and they're saying, do you have a problem with alcohol? Do you hide it from your family? Is it affecting your health negatively, but you don't care? I'm like, I feel judged. But yeah, that's where it was. And it was not a pretty place to be. And I wasn't nourishing my body. So when we talk about how we should eat or the goals, I really want y'all to think about it in terms of nourishing your bodies. Like, you deserve good food. You deserve nutrient density, anti-inflammatory food. And we're grown-ups now. We can, we don't need to eat Fruity Pebbles. I have a client right now who's on the max dose of Ozempic, and he lives on beer and Fruity Pebbles, so he's not losing weight. I'm like, you just stop that medication. You're wasting your money on it right now. But yeah, we don't need to punish our bodies, and we can look at it in a more abundant sense. Like, we're taking care of ourselves. What is insulin? So we've been talking about insulin resistance. This was all new to me, because if you've ever gotten labs done, your doctor's probably not testing your fasting insulin. They are going to test your glucose in your comprehensive metabolic panel. They might test your HbA1c, your average blood sugar over 3 months, but maybe not. And they're definitely not going to test your insulin. But insulin starts to creep up and get high decades before it shows up as diabetes, right? So you might, for years, have normal glucose, normal A1C. Meanwhile, you still have insulin resistance brewing in the background. That's what happens when you go to the doctor and you're like, I can't lose weight. I am exhausted all the time. It comes 3 o'clock, I'm just crashed and I have sugar cravings. I'm accumulating visceral fat, especially. That's a sign of insulin resistance. And your doctor's like, well, your blood sugar is 85 and your A1C is, 5.5, 5.6 is the cutoff for prediabetes. We'll talk about the optimal levels for all that. So what raises insulin? So insulin is a fat storage hormone. It tells our bodies what to do with the calories we're eating. So it tells our bodies to store fat rather than burn it. The way I think about this is if you think about type 1 diabetics, before we had exogenous insulin to give them, like if you were to Google that right now and look up a type 1 diabetic in 1900, before we had insulin, they'd be in bed in a sanatorium in like New Mexico, and they would look like concentration camp victims. Because without insulin to tell your body what to do with the calories you're eating, they can put on body fat. And so when people are confused about it's just calories in, calories out, it's not the calories, it's the insulin response. So what we're going to talk about today is moving toward not a restrictive eating plan. I call it a way of eating. I don't like diet. We're going to shift calories to more insulin sensitive ones like fat and protein and micronutrients and minimize the carbs. If you're still on the fence about whether it's calories in, calories out, or the insulin response, the other really sad phenomenon that exists is something called diabulimia. Has anybody heard of diabulimia? Okay, this is when type 1 diabetics, usually teenage girls, will not inject their insulin on purpose so they can eat whatever they want and be skinny. And I've actually seen this, one of my daughter's friends at prom last spring, and she's 5'9" and maybe was 100 pounds soaking wet. And I know she's type 1. And I was like, okay, that's probably what it is. So it really is the insulin, and it makes a big difference. So how do we lower insulin? So carbs are going to raise it the most. Carbs, gluten, sugar, alcohol, that kind of thing. Protein's going to raise it a little bit. Fat, which we've been scared of my whole life, right? Like fat-free SnackWells, I got to eat that, and that's a health food. That doesn't raise insulin at all, you guys. Now, I'm not saying go eat a bunch of trans fats and fried foods. We're talking about healthy fats. But yeah, so switching things up, and y'all, fat is so delicious and satiating, and same with protein. You'll be so full on this way of eating. I spent my whole life being starving all the time on the low-fat, high-carb situation. It was just a treadmill of constantly thinking about food and where's my next sugar and carb going to come from. And it's a struggle to get in enough protein every day when you're eating this way. And it feels so much better. It just feels like abundance instead of restriction. And I love that. We only need 1 teaspoon of glucose in our bloodstream at any one time. More than that is toxic to our bodies and starts to create micro tears in our vasculature. Then cholesterol is deployed to spackle up. And the more we have, the more pancreas has to release insulin to get that blood sugar out of the bloodstream. That is insulin's job. There is no essential carbohydrate. This is shocking when I learned this. So I've heard of essential fatty acids or fats that we have to consume because our bodies can't make them. We also have essential amino acids that we have to consume, or proteins, because our bodies can't make them. There is no essential carbohydrate that we have to consume. We could just not eat any carbs. I don't recommend that at all. I don't even recommend ketogenic diets. There's some men who really do well on them, and maybe postmenopausal women. And if you're already on it and you're loving it, stay with it, that's fine. But I don't think it's necessary. So gentle low carb is what I generally recommend. But yeah, our bodies can make all the blood sugar we need from our livers in this process called gluconeogenesis. So the liver takes fat and protein and turns it into sugar. So if you guys have ever gone to get your labs done, this is me. Some of us just have high blood sugar in the morning, even when fasted. That's the cortisol response, which we all have in the morning. The cortisol response tells the liver, hey, it's time to wake up. Make a bunch of sugar, and it does. It's a little sugar factory, gluconeogenesis, make new sugar, and it causes your morning blood sugar fasted to be in the 90s or sometimes even higher. When I had type 2 diabetes, it would be like 120. I'm like, I haven't eaten for 12 hours. How is this possible? Now it's more in the low 90s. but my A1C, my average blood sugar is nice and low, 4.9. My insulin's between a 2 and a 5. We'll get to that in a little bit. But yeah, so we don't really, there's no essential carbs. So what I try to focus on, so when we eat carbs, we want to keep them nutrient dense carbs, right? Like non-starchy veggies and low glycemic fruits and nuts and seeds and avocados and those kind of things. And keep them at the end of your meal. And we're going to talk about CGMs too. I love continuous glucose monitors for personalizing your way of eating to you. Love, love, love them. If you start playing around with a CGM, you'll find that sometimes if you eat certain carbs, even if it's berries or a vegetable, some people, their blood sugar will spike. But if you eat your fat and protein first and then have your carbs, your blood sugar is nice and stable. You didn't spike your insulin, everything's chill, so you can still have those nutrient-dense carbs. You can play with it. So carbohydrate overload equals chronically high insulin. So the more carbs you eat, the more your pancreas is having to push out more and more insulin. And it can get to the point with most Americans where even fasting, you have a high level of insulin running through your body. Insulin is the fat storage hormone. So even when you're fasting, this is when people come to me and they're like, Kelly, I look at food, I eat air, and I'm gaining weight. And if their insulin will be like a 30, we need it between a 2 and a 5. So you're not crazy if that's happening to you, because 94% of Americans are metabolically unhealthy. It's this toxic soup we live in. It's really difficult to find and understand what to eat. The chronic stress, you guys, nobody should have to live the way we do. It's wild. It's like late stage capitalism. And that's one of the things I love that Brooke decided to prioritize this for you guys, is because, it doesn't have anything to do with your industry specifically. But when you take care of you, it's going to bleed into how you show up for all the people you serve. Because you're in a service industry, you're putting everyone's needs in front of your own. And especially during high season, it's got to be a lot. So the better you are and the stronger and more resilient you are, and if you know how to take care of yourself, you're going to get sick less often, you're going to have more energy, you're going to have more fun, you're going to make more money. Yeah, too many carbs, we get chronically high insulin, and insulin is inflammatory, so we get inflammation, and then we get weight gain. Insulin resistance develops after years of excess carbs, leads to weight gain, heart disease, diabetes, dementia, cancer, infertility in women, like PCOS, number one cause of infertility. Root cause of PCOS is insulin resistance. And then low testosterone in men. So ironically, insulin resistance causes women's testosterone to go way up and men's to go way down. So it's very interesting. Erectile dysfunction, visceral fat, and fatigue. This is just a little side note, because I know a lot of people are on blood pressure meds. High carb diet directly linked to high blood pressure. So when we consume 1 gram of carb, for every 1 gram of carb we consume, we retain 3 grams of water, which water retention is linked to high blood pressure. This is why diuretics are prescribed to lower blood pressure, but diuretics have a host of side effects that people don't like, from fatigue to erectile dysfunction. So when I talk to men, it's mostly men on blood pressure meds. They hate how they feel on them. I'm like, well, what if you started eating more steak and bacon and broccoli and stopped with the chips, and then your testosterone is going to go way up when you do this? Oh, random. This is such a cool stat. They did a study on men with low testosterone. This group got actual testosterone injections. This group didn't get any testosterone, but they gave them a GLP-1, Ozempic, Wegovy, Mounjaro, Zepbound. Guess which group's testosterone went up the most? The GLP-1. The GLP-1, just by reversing insulin resistance, their testosterone like doubled. And I've seen that in my coaching clients too, but that was wild and so important to know, especially for young men who still want to preserve fertility. So anyway, lowering carbs plus GLP-1s, which are so helpful. They help us lower carbs. Like, we cannot be expected to be surrounded by addictive foods that these processed food companies have come up with and not need some assistance. And that quote from Dr. Mark Hyman, "Don't blame salt and fat for what sugar and starch," said. Signs of insulin resistance. How do you know if you're insulin resistant? You get your fasting insulin and it's over a 6. We want fasting insulin between 2 and a 5. Waist more than half height. So I brought my little tape measure. if anyone's feeling brave and wants to test it, but that's a big one. Overweight, obesity, weight loss resistance, that's a sign of insulin resistance. Insomnia can be one, because when you have blood sugar dysregulation, we have insulin resistance. If you get a CGM, you'll see spikes in blood sugar, and then it will go really low and then high and low. And so your energy throughout the day is just not great. Focusing more on good fats and proteins and or on a GLP-1 medication, we'll see blood sugar stay right around the 70 to 120 range, which is the goal. Cravings, energy crashes. It's insulin, not the calories. And I talked about the type 1 diabetes and diabulimia. Can't gain weight without insulin to tell the body what to do with the calories. When I was reversing my type 2 diabetes with what my doctor had me doing, which is what I'll recommend, is 100 grams of carbs a day, total, not net. At one point, I was tracking my food on my MyFitnessPal just to track my carbs. I wasn't focusing on calories or weight loss or anything. I was 40 pounds heavier, but I was still in the normal range, and just nobody was saying anything. And I don't know, I think I wore it decent. I don't know, it was all right. But what I did notice, because MyFitnessPal will throw your calories up there right for you to see, is that as I lowered carbs, by definition, you're raising fat and protein. So my total calories were going up. But I was losing weight. And at one day, it was months in, and I had gotten down to my high school weight. I was like, how is this possible? I'm 40, whatever. And I looked back and I was like, I ate 4,000 calories yesterday and I lost 2 pounds. And what is this? And I called my doctor and I said, okay, I'm at my high school weight. We don't need to go to middle school weight. I'm not trying to do this. This is my calories. And she goes, oh yeah, it's not the calories. Carbohydrates are the lever you're going to use to stabilize your weight. So she's like, it's time to add back more nutrient-dense carbs. We're not going to eat chips and cookies. We're going to get nutrient-dense carbs, because my hair was falling out too. So that was another issue. We want nutrient density. So I added back more berries. Apples I started to eat again. Every once in a while, I add like a sweet potato, and my weight just stabilized right there. And this is so crazy. And I'm full all the time. Like, this is witchcraft. But it's true. So anyway, the higher that your insulin is, the more fat we store. What to eat, how we fix it. Low carb, not keto. If you love keto, go for it, but it's not required. So ketogenic diet would be about 20 to 50 total carbs a day. Just very low, y'all. That's so hard. That's just not sustainable. It's fine. I did it for a little while in the beginning, and my doctor was like, you don't need to do that. So about 100 total carbs a day, not net. So net carbs are a marketing ploy by processed food companies like Quest bar cookies. If you look at them, it says 2 net carbs, 12 grams of protein. You're like, well, this is a health food. It's a super processed way to sell you things. If you look on the back, though, and look at the total carbs, it's like 22 total carbs. And I can eat 4 of those in a row. So that's my 100 total carbs a day. So I would eat those, and my blood sugar on my monitor would spike. And I was like, what? This is crazy. It says it's 2 net carbs. I'm like, no, it's because our bodies don't do net carbs. Our bodies know better. They register total carbs. So I'll see that often. I'll do food log reviews for my coaching clients if they're stuck. A lot of my coaching clients are on GLP-1 meds, and they're very powerful. And sometimes they'll get plateaued. And I'll say, hey, just write down everything you eat and drink for a week. No amounts are necessary. Just see what you're eating. And almost always, there's something easy we can tweak. And so many times, they're tracking net carbs instead of total. So they're supposed to be getting 100 total carbs a day, but since they're tracking net, they're really eating 400 or 500 total carbs a day, which is like, yeah, which is crazy. And if you hate tracking, which I don't track anymore, I just put on a glucose monitor, and that's my little come to Jesus about what I should be eating. High protein, high good fats. We want at least 100 grams of protein daily. For women, especially as we age, it's so important for our hair not falling out, for building muscle mass. We need at least 60 grams of protein daily just to run our internal organs. So that's where I get really motivated, where I'm like, wait, have I even gotten 60 a day? Am I going to start to catabolize my heart? We just really want to take care of that. High good fats. Don't be afraid of fat. Fat's wonderful. It's satiating, does not spike insulin at all. Just dump olive oil on everything you can. I love chicken now because I can dump olive oil all over it and make it much more juicy. And then focus on nutrient-dense, anti-inflammatory, real whole foods. right? Like people try to complicate it. It's really not. Like one ingredient foods that come from the earth, meat, fish, poultry. Try to make it a good quality if you can. But honestly, I am not super picky about that. Like a dirty paleo can work. If I'm out to eat and they have farm raised salmon, I'm not going to turn my nose up at that. It's better than getting the waffle platter, right? It's still going to keep my blood sugar in where it's supposed to be. So yeah, don't be too hard on yourself. You don't have to be perfect. Shop the edges of the grocery store. Eat your protein and good fats first, and then non-starchy veggies, and then your aim for protein, and then the 100 carbs a day. And I talked about the net carb marketing. Lifestyle essentials. Sleep before midnight if you can. And this is me just saying things that I don't actually do because I cannot fall asleep before midnight. And I weaned off sleep medicines a month ago. And so I just am on my own body clock now. But apparently, you get most of your deep sleep before midnight. And I will see that in my sleep trackers, although I still get decent deep sleep now, even though I'm not. So if you can, prioritize that, especially if you have to be up early. Strength train at least twice a week. So don't go on any weight loss diet, or whether it's with a GLP-1 medication or not, and skip the strength training because you will lose muscle mass in the process. Consider a glucose monitor. Love these, you guys. They're over the counter now. You can get them from Hello Lingo. That's the least expensive one. That's direct from Abbott, the manufacturer. This is the best way to personalize your insulin sensitive lifestyle to you. Like my husband and I will both eat grapes and my blood sugar will go way up here and his is just fine. So you don't want to have to overly restrict. Like we are so done with that, right? So if there's a food that is healthy and nutritious, like a fruit that you don't have to get rid of because your body is fine with it, well, I want to know that. But if it's something that's triggering you because you're insulin resistant right now and it's just not your friend food, you can skip it for now, or you can play with ordering it, reading your fat and protein first. Love the CGMs. And I love that they're finally over the counter. It's about time. Talked a little bit about this. So there's a difference between Band-Aid pharmaceuticals and root cause medications. Like I didn't have a cortisone shot deficiency in my shoulder. I had an estrogen deficiency in my shoulder that was fixed by replacing estrogen. We don't have, especially women in our 40s and 50s, we don't have a Xanax or an Ambien deficiency if we have anxiety or insomnia. But we very likely have a progesterone deficiency. Progesterone's nature's Xanax, nature's Ambien. And then I talked about the phentermine. We don't have a speed deficiency, but they have documented GLP-1 deficiencies in patients as we age, but also with overweight, obesity, prediabetes, and diabetes. So when I think about GLP-1s, the skinny shots, I put them in the same category as my thyroid hormone replacement. It's replacing the same molecule in my thyroid that it would normally make, but I have Hashimoto's. As my testosterone replacement, my progesterone, and my estradiol. Our body makes all of these. So it's GLP-1 is like bioidentical hormone replacement for your metabolism. That's how I see it. And there are some Band-Aid medicines, you guys, that I love that I could talk about. Like I love Cialis for women too. If you're a woman, you're like, oh, Cialis is the boner pill for men, or it's for prostates for men. Yes, but guess what? The clitoris is the penis. It helps with blood flow with us too. I'm just saying. Blood flow also helps with hair growth and helps with cardiovascular health. So anyway, love Cialis. So there's a couple of those. Oral minoxidil for hair loss. Love that. We don't have a minoxidil deficiency. I get it, but it works really well if you have hair loss, and hair loss is so devastating. And libido is important. I feel like it's part of health. When we have low libido, it can be, unless it's just we've never had a libido, it can be a sign of cardiovascular health. It definitely is. The main cause of erectile dysfunction in men is cardiovascular disease. And it can be the same thing for women. Okay. Root cause treatments restore what's missing. Yes. Prescriptions that cover up symptoms. These are the root cause solutions, the GLP-1s, thyroid hormone replacement, BHRT. Replacing the same molecule our bodies make, treating the root cause, not just managing or covering up symptoms. Here are the labs that everybody needs for cardiovascular health, and these are the labs that we track for our weight loss patients. So patients who are on the GLP-1 meds. specifically, but I also track them for my coaching clients who come to me who are just losing weight through diet and exercise. So we want to track the metabolic healing process when they're on the medication or they're changing diet and lifestyle. So comprehensive metabolic panel, which is going to include your fasting glucose, your liver and kidney function, your lipid panel, that's going to be your cholesterol, HbA1c, your average blood sugar over 3 months, your fasting insulin, and your HSCRP, which is an inflammatory marker that's super important we'll talk about. Optimal ranges keep you out of the danger zone for weight gain, especially belly fat, heart disease, diabetes, dementia, and other chronic diseases of aging. Comprehensive metabolic panel. If you have your labs, you can bring them out, or if you remember them or look them up on your phone. The main ones we're looking at in the comprehensive metabolic panel are glucose. We want glucose optimally between a 70 and 85. Like I said, mine is still in the upper 90s just because I have every gene for type 2 diabetes and my liver tends to make a lot of blood sugar, even fasting. But that's okay because my other labs are good. Liver function. AST and ALT, we want optimally under 20. When it starts to go over 20, it's typically due to excess carbs and we start to get into fatty liver territory. That's where I was. I had fatty liver too. That's part of the reason I had the abdominal fat. In the old days, if people had high liver enzymes or fatty liver, it was due to alcoholism. But these days, with 94% of Americans being metabolically unhealthy, it's mostly due to excess carb consumption. But to lower AST and ALT, improve those liver enzymes, it's carbohydrates and alcohol to get those down. And then we have kidney function. So our kidneys, that's what fails and people end up on dialysis when they have advanced type 2 diabetes. That's why we have dialysis clinics in like every strip mall in America. This is your kidney filtration rate, eGFR. We want that above 90. That's the optimal range for that. Kidney function drops with insulin resistance and diabetes and prediabetes. You guys, it also drops. Your kidney function doesn't drop, your eGFR will drop because if you are on a bunch of creatine, which who's on creatine right now? It's so big. Is anybody? Yes. So I'm taking 10 grams of creatine a day. That's going to raise your creatinine levels, and that's going to affect the eGFR calculation. So if you're on a bunch of creatine, like a bunch of us are, for building muscle mass and for dementia prevention, yay, we love it, the mental clarity, you need to let your doctor know so they don't freak out and think you have kidney failure. Because you don't actually, the creatine is going to affect the processing of that lab. So instead, write this down. You're going to ask your doctor to run a cystatin C test. Yeah, CY, statin, like STATIN, C. And that will get around. Because we want to identify people, a lot of people do have kidney function issues. And we want to identify if you really do have true poor or falling kidney function. That's very important to know. But if you're on creatine, the regular test, especially if you're on a lot of it like I am, it's not going to show it. So cystatin C test to ask your doctor and definitely tell them you're on creatine so they don't freak out. The way to improve these labs is low carb plus GLP-1s. Those are going to lower the blood sugar and AST, ALT. The GLP-1s, you guys, where they really shine is burning off visceral fat and fat within our internal organs, like fatty liver. And we get fatty infiltrate in the pancreas, in our muscles, all kind of things. And the GLP-1s also boost kidney function. They had to stop the study on kidney function with GLP-1s in the middle and give the control group semaglutide because it was considered unethical to continue the study and not give the medication to the control group because it was improving their kidney function so much. Wow. Okay, any questions about your comprehensive metabolic panel? Yes? That's a great question. I should know that, and I don't know. Creatine, it seems like it would be. I know. It ends in INE, and that tends to be like leucine, valine, like all the other amino acids. I'm going to guess it is. I don't know. We're just going to throw it out there. Somebody want to chat it real quick? Raise your hand, and we'll have the actual answer. I'm not opposed to learning new things. That's going to be my guess. Lipids, you guys, cholesterol. So we've been taught you have to, stay away from saturated fat. This is so bad. Cholesterol has really been villainized, and it is so crucial for our bodies. Cholesterol is the building block for every hormone in the body. So when I see men come to me on statins, they have testosterone lower than mine. Yeah, we're going to talk about that more in a minute. Cholesterol is cancer protective. Below a certain level of cholesterol, we start to see increases in many types of cancer. LDL fights infection, so helps with our immune system. So it's not bad. It's deployed by the body in reaction to repair inflammation, right? So if you eat a bunch of carbs, gluten, sugar, alcohol, you inflame your blood vessels. There's micro tears in the vasculature. Cholesterol is deployed to spackle that up. And it's not the cholesterol's fault. We need to reduce the inflammatory inputs to the body, and then cholesterol chills out. And the most inflammatory things we can put in our body are alcohol, sugar, processed carbs, gluten, and then for some of us, cow's dairy. But there's a lot of us who can do cow's dairy. But that's carbs, gluten, sugar, alcohol. And processed carbs and sugar. Cholesterol, total cholesterol, we want 150 to 200. That's also the normal range. But if yours is higher than that, mine's higher than that for a long time, it's not necessarily a bad thing. There are some studies showing that a cholesterol 222 is actually optimal. The people with the highest LDL live the longest, and people with higher cholesterol seem to be healthier. And then LDL, we want under 100. But what's really important is how much of your LDL, we think of LDL as your bad cholesterol, but that's actually incomplete information. There's good LDL, that's large fluffy particles that are not disease promoting. And then there's bad LDL. That's the one we don't want. Those are the small, dense particles that promote heart disease. So really the question is, if you're looking at your labs right now going, oh my gosh, my LDL is 150, 200, it's been flagged high. What we want to know is how much of that LDL is actually the large fluffy particles, or are you dealing with a bunch of small dense ones? That's the main issue. And the way we figure that out, this is not going to be in your labs, is calculating your triglyceride to HDL ratio. So your triglycerides are going to shoot through the roof with carbs and alcohol. We want triglycerides below 70. If they're higher than that, then that's a sign of insulin resistance and poor metabolic health. And then your HDL, that's your good cholesterol. We want that higher, like around 50 to 60. We raise your good cholesterol by eating good fats and weightlifting. That's exercise. So triglyceride to HDL ratio. Does anybody have their triglycerides or HDL they want to share? We can do the little combo with them. So if you have triglycerides that are, say, 100 and your HDL is 50, then your ratio is 2. Most functional medicine practitioners say a triglyceride to HDL ratio of 2 or below is pretty good. Most of your LDL is probably the large and fluffy particles. If you have Alzheimer's in your family like I do, Dr. Bredesen wants us to be aiming for a triglyceride to HDL ratio of more like 1 to 1. So that would be triglycerides around 60 and HDL around 60. That is very low risk of heart disease, excellent metabolic health right there. So if you can get it there, that would be like the super optimal triglyceride to HDL ratio. Any questions about that? Yes? What is too? That's such a great question. Yeah, I've never actually had that question or seen it. I don't know if it could be too low. It might be it is too low, it might be some sort of genetic issue. Somebody's maybe on a statin and something is really low. I don't know, but no, I don't think it could, that ratio could be too low. That's a really good question. But I've seen like a 0.3, and that's just, yeah, that's good. Low triglycerides just means you're eating low carb, which is great for you. High HDL means you're exercising and eating good fats. And so really the lower the better probably. But it's not the lower the better when it comes to LDL and cholesterol. That's what doctors will say when they put you on statins. Oh yeah, the lower the better. Cholesterol is just terrible. But you start to see with super low cholesterol, We start to see dementia. We start to see low hormones, diabetes, statins. This is the next slide, actually. Side note about cholesterol and statins. Statins double the risk of diabetes. They increase the risk of dementia because dementia is type 3 diabetes. It's like diabetes of the brain. They increase muscle aches and pains. They deplete CoQ10. This is what kills me. CoQ10 is a critical heart and muscle nutrient. And doctors know that statins totally deplete your CoQ10. And they are not telling patients they need to be replacing it if they're on a statin. And because cholesterol is the building block for every hormone in the body, when you plummet someone's cholesterol, their hormones plummet. So the men coming to me on statins have testosterone lower than mine. They're diabetic, they're insulin resistant, they have large bellies, and their man parts do not work typically. And they're not super happy about it. They can't work out because their body hurts. And we get them off the statin, get them on testosterone, GLP-1, and Armour thyroid, and they're amazing. So benefit, tiny for men. For women, there's higher all-cause mortality in women taking statins. The only woman I know of a coaching client who was on them started showing signs of dementia within 6 months of taking them. And I was on the phone with her. She just wasn't making sense. I don't know what it was. I just ended up staying on the phone with her a little bit longer, probably because the dementia thing runs in my family. And I don't know, I just wanted to talk to her. And I just started asking questions like, okay, are you on any other medications? Because she wasn't losing weight on the GLP and we were trying to figure it out. And she finally said she was on a statin. And she was talking about how she couldn't find her words and it was frustrating. And I noticed it, like definitely obvious dementia. And I was like, first of all, I asked her, when did you start noticing your memory failing? And she said, probably the last 6 months. And I said, okay, when did you start the statin? 6 months ago. I was like, okay, do you have somebody who you can talk to about this? Write this down so you don't forget and get help and go to your doctor and see if you need to be on this. Because honestly, GLP-1 medications, Ozempic, Wegovy, Zepbound, Mounjaro, that's replacing statins. There's a 20 to 50% reduction in heart disease risk on those meds, whereas on statins, you get like 0.4%. You maybe get 4 days extra in lifespan, but like a host of all these other side effects. So root cause medicine, changing diet and lifestyle, plus a GLP-1, much, much more effective. Tell the men in your life because they're the ones being put on statins. There's a much better approach, much more effective approach without the side effects. Yeah. You switch doctors or you do it. My husband did. Yeah. I mean, look, yeah, it's really hard, right? Because yeah, they're going to sit there and this is what my husband did because I was telling him all this. They had him on a statin. He was 40 pounds heavier, the belly and the round face and the low testosterone and the whole thing. And I was like, this is what's happening to your body on the statins. And he just told me, okay, I mean, they're motivated when it comes to their hormones and their functionality down there. And he said, okay, fine, I will give you 90 days. And at the end of the 90 days, eating low carb, replacing his testosterone, no statin, no alcohol. He got on Armour thyroid and started a GLP-1. He was like, I feel superhuman. He had already started a new company, like his brain turned back on. Everything was working great down there. And he was going to the gym, but he couldn't put on muscle mass because his testosterone was so low because of the statin. And he just quit the statin. He didn't tell his doctor. Now, I'm a health coach, not a doctor. Always consult your doctor before making any changes to diet, lifestyle, exercise, nutrition, medications, supplements. That's the attorney in me. But no, Jonathan he was like, I'm done with these. And he just started doing all the other things. I mean, look, high cholesterol, a lot of people don't know, it's the sugar and the carbs. It's also thyroid function. High cholesterol and low thyroid function go hand in hand. And there's no cardiologist I know that's doing a full thyroid panel and treating thyroid, which should be done before you start anybody on a statin, which has all these known side effects and risks, right? Whereas if somebody has low thyroid function and you give them Armour thyroid or especially something with T3 in it, their cholesterol often becomes much better. And you add a GLP-1 to that, cholesterol is perfect. You don't need a statin, right? And then hormones. good grief, you guys. My cholesterol was always like 222, which I was fine with. I had a good triglyceride to HDL ratio. I'd been taking testosterone and progesterone for probably most of my 40s. That's typically what we do in perimenopause. Perimenopause, we have enough estrogen. And then I started getting to my late 40s and noticing that not only was my estrogen coming back low, I could feel it, right? The joint pain, all that kind of stuff. So I added estradiol in. My cholesterol is now 149. And I'm like, that's too low. Like, I worry about it. There are some studies that show cholesterol under 150 is a risk factor for dementia, but there's nothing to be done unless I go back to eating Pop-Tarts and Mountain Dew. And, I lived in Arkansas for a while. It was the whole thing. When in Rome. But yeah, that's such a great question. Ultimately, it has to be his decision. But if he wants to talk to Jonathan, Jonathan's an evangelist for this whole program. I should have brought a before and after picture of my husband because he looks so different. He's almost 60 and he looks like such a baddie. He is buff and lean and functional and just on it. And brain is working. Yeah, I know. Like, we're doing it. It's great to have a partner to do this with who's on board. And I knew once he saw the benefits of it. I found his atorvastatin in his bathroom the other day. I was like, oh man, remember this? And he was like, oh, I got to throw that away. Like, terrible. But yeah, it's got to be his decision. And yeah, especially if blood sugar is an issue, statins are not doing any favors for that at all. So let's see. Okay, next. HbA1c and insulin. So A1C is it's kind of confusing because it's hemoglobin A1C. So hemoglobin is in your complete blood count. That's like about your iron levels and stuff. Hemoglobin A1C or HbA1c is a measure of the average blood sugar over the last 3 months. So it's kind of a rolling average. So you get your glucose done. That's what is your blood sugar right at that point. And then A1C is like, okay, what is your general average then over the 3 months? A1C, optimally, we want under a 5. I finally have mine at 4.9. It's been like years and years. Just know that when you make these changes, that you will continue to improve year over year after year. And the longer you do it, the more carbs you can eventually tolerate as your metabolism heals. Insulin, we want between a 2 and a 5. If you have your labs, look at the normal range for insulin. Usually it goes up to like the 20s or 30s. Y'all, that is severe insulin resistance. I see this in my coaching clients. If insulin is above a 5, I see that patients having a much harder time losing weight and maintaining weight loss because insulin is the fat storage hormone. That 2 to 5 insulin optimal range, that's directly from Dr. Mark Hyman. And I've seen it I've analyzed thousands of labs probably at this point and worked with so many patients on weight loss. If they have high insulin, weight loss is super slow if it's above a 5. It's maybe less than half a pound a week for a while. And then what will happen is they continue the low carb, they're doing the JLP, blah, blah, blah. Several months in, all of a sudden they'll call me and say, I lost 5 pounds this week. Oh my gosh, what is going on? I said, okay, it's time to get your labs redone. Get your insulin redone. Every single time their insulin's below a 6. It's like this magic, I don't know what it is. And that's the same with my husband. Like, he had been letting more carbs back in and had been putting a little more belly fat than he wanted. He got his labs done. His insulin was just up to a 7, which is not even that much higher than a 2 to a 5. It was already affecting him. And so the insulin is one where the optimal range is so much more accurate than the normal range. Insulin tells our bodies to store fat. High insulin makes weight loss more difficult. It raises inflammation and increases risk of heart disease. Lower insulin is much easier weight loss, less inflammation, less all-cause mortality. The higher the carb intake, the higher the insulin. Any questions about A1C or insulin? Love this one. This is one you may not have heard of. HSCRP, or high sensitivity C-reactive protein. This is an inflammation marker that risk stratifies you for the likelihood of a cardiac event, stroke, or dementia. So this is like your risk of death measure. Doctors are not testing this. So important. We optimally want this one below 1. Higher levels are associated with major cardiac events, stroke, dementia, autoimmunity, visceral fat, obesity. This marker helps predict your risk before problems occur. So you can also have a blip, like if you're going along and you have your hsCRP below 1, because you get your labs done when you're sick, recovering from an illness. It can spike up when you're having an autoimmune flare. Maybe you just had some surgery and you're healing. It's just a general inflammatory marker. But this one is huge. You guys, one shot of a GLP-1 at a microdose of a GLP-1 is defined as anything less than the standard starting dose, because I do the labs for these. And occasionally we'll have people who will get their hsCRP done the week before. They'll take their initial microdose and then we'll have them repeat. This goes down by half after one microdose. So risk of death down by half, one microdose. They haven't lost any weight in a week. Most patients don't lose weight on GLP-1s the way I recommend doing it. Is starting low, go slow. So mostly the weight loss is months 3 to 6 when you titrate it up. So these labs are improving on these medications independent of weight loss. People are like, oh, they're just losing weight and that's all it is. Nope. It's improving all of these cardiometabolic labs before weight loss even starts. Because your body has to get healthy in order to lose the weight. If you're insulin resistant, you're inflamed, your body is basically in a state of fight or flight. It's like being chased by a saber-toothed tiger. And when that happens, our body kind of shuts down and says, we're holding on to every fat cell. We are not going to ovulate. We're not going to grow hair. We are not going to lose weight. We're going to become insulin resistant as a protective measure. And that was great when we were cavemen to keep us safe, right? But now we live in this super abundant, ultra processed, hyper palatable food environment. That's not super, super helpful. So that's hsCRP. So compliance is hard and it's not your fault. It really isn't. Like it is so hard. Remember when I talked about the cake frosting in the bathroom? Like I never was a big drinker to begin with, and I quit drinking in 2014. That was easy because I don't have to drink alcohol to live, right? If you're a heroin addict, you don't have to inject heroin to live. We have to eat to live. We're surrounded by food. So if that tends to be the thing that's addictive for you, which I think it is for most of us, I don't know if I mentioned this before this, but if you feel bad about what you're eating and not being able to change things, they put rats in a maze and they give them the option of meth, heroin, cocaine, and sugar. What do you think the rats chose? They chose the sugar, right? Over heroin, meth, and cocaine. So we are just doing the best we can. We live in a capitalistic food society. Big food companies, they are responsible to their shareholders. And so they want to use the cheapest filler ingredients that are also addictive. If you don't know this, food companies employ scientists to figure out the cheapest, most effective combination of flavors that is going to addict the consumer, like Pringles, right? What do they say? They even taunt us. Bet you can't eat just one. They know. They had a scientist figure out how to make it that addictive for us, and that's how it is. Nobody binge eats on steak and broccoli, right? They do this on purpose. In fact, okay, this is a little bit of a tangent, but I want you to know this. Big food companies currently have a scientist at Stanford trying to figure out how to engineer GLP-1 resistant foods. Yeah, so it can bypass, so this won't work. You will still have your cravings. That is so mean. It's all about money. That's how it works. So this is biology, not willpower. It's time for us to vote with our wallets. And think about it this way, even if it feels a little more expensive on the front end when you're buying healthier stuff, you're saving so much money on the back end in quality of life, in long-term care. And honestly, the healthier you are, the longer you can work and the more money you'll make. GLP-1s explained, people are like, why are you bringing GLP-1s into this? Because everyone's talking about them and they are the biggest advancement in longevity since penicillin. And if you don't know about them, within 5 years, everyone you know who has access and can afford them will be at least on a microdose for cardiovascular disease, because microdoses don't lead to weight loss, typically. I've seen it a couple times in super young women who maybe have all their hormones and their thyroid's perfect and they're just using it for losing 5 pounds or whatever. That's fine. These are incredible when done properly. It's a dosing and management issue. So they've been in the news a lot for side effects, and the side effects happen on the large doses with the self-injector pens, which start at a high dose and then you're doubling it each month, even if the other dose was working for you. What my coaching clients use is the compounded form. You'll have your own vial of medication. You can draw up 1 unit of medication to start with if you want, and you can personalize the dose to you. You can move up much more slowly. I am hired by medical practices to run their GLP-1 programs and do the coaching for it. And every time I do that, I come in and they're using standard dosing and they're writing all these Zofran prescriptions. And so the first thing I do when I come in is say, hey, we're using compounded, we can personalize this. Can we change the dosing, start lower, go slower? And they're like, oh, we didn't know we could do that. Yeah, it's the best way to do it. And you avoid the side effects. You get side effects, people just quit and then they lose all of the potential benefit of these medications, which is just incredible. The lab improvements are insane. The weight loss is a cherry on top. The weight loss happens when the inflammation comes down and the metabolism's healed. GLP-1s, good grief. Everybody knows them about weight loss, but there are so many benefits independent of weight loss. Like even if they didn't cause weight loss, they would still be the most important advancement in longevity since penicillin. They really would be. Heart disease risk down 20 to 50%. Of course, they reverse diabetes. That's where they came from. They lower inflammation and autoimmune antibodies. So I work for a thyroid clinic. We're seeing reversal of Graves and Hashimoto's disease on these. Of course, you have to be doing all the other things too, but sometimes, patients will go off gluten and dairy and they're still having Hashimoto's flares, but this brings it down. It has a global anti-inflammatory effect. Eczema, psoriasis, chronic pain, supports Alzheimer's prevention, reduces addictive behaviors of all kinds. So really helps with a binge eating disorder because it reduces that food noise. But addictive behaviors of all kinds, whether it's smoking, shopping, gambling, doom scrolling, alcohol, you guys, it's so cool. My friends who started drinking too much during COVID, they were like, can I try this just to moderate my alcohol consumption? And I'm like, yeah. So get them on a dose. They figure out whatever their optimal dose is. And they're like, I am now drinking 1 glass of wine at the party instead of 5 drinks, which I don't need to be doing at my age. Especially women, we already have less of the enzyme that metabolizes alcohol. It's called dehydrogenase, and we have less and less of it as we age. So a lot of us, this would happen to me at 41, I quit drinking. I was just like, why? I just can't tolerate it anymore. I have a 1-week hangover from 1 drink. I was like, I guess this is not for me. Now I have my electrolyte and creatine powder at events. And then I found mushrooms, so at least I have something. And that's good for my brain. Sleep apnea, I was talking to somebody about this. Somebody has been on sleep apnea. Is FDA approved for sleep apnea, actually. So if your husband or somebody has that, try to get it covered by insurance. It would still be the brand names. So you'd be kind of stuck with higher doses, but if it's covered by insurance, it's worth it. And improves fertility, like flat out. So the biggest cause of infertility in women is PCOS. Root cause of that is insulin resistance. People talk about Ozempic babies. Super exciting. You get these young women who are not ovulating on these medications. They don't even have to lose that much weight. So maybe 5 to 10 pounds, they could still be in the obese range. And they'll start ovulating again because the inflammation has gone down so much. And then they can have babies, which is so beautiful. And without IVF. Safety and history. I was asked to research these meds for a medical practice several years ago, and because they wanted to add it to their practice. And so I was learning all about it and I thought it was a new medication, and it's not. We have had GLP-1s for 20 years. They were first synthesized in the 1980s. And then the first one came to market. It was called exenatide in 2004. So we have 20 years of safety data on these meds. Extremely safe. A few years after exenatide, we got liraglutide. Exenatide was a twice daily injection. Who wants to do that? That's not fun. Liraglutide was a once daily injection, but it really wasn't until 2017 that when semaglutide came out, Ozempic, Wegovy, once weekly. They tweaked the molecule so it lasts a week. Then it became a lot more popular and we started seeing it in the news and all your friends started to get on it. And then tirzepatide came out a couple of years after that. Tirzepatide is a GLP-1 agonist. Tirzepatide works on two pathways, GLP-1 and GIP. It has slightly better weight loss results with slightly fewer side effects. These are FDA approved for lifetime long-term use, just like bioidentical hormones. I will die with my estradiol patch on, with my injectable testosterone, all that. Like, why not? If we have a GLP-1 deficiency, we're dealing with insulin resistance and metabolic damage, why not? But you don't have to stay on them forever. And I do see people come off, especially if they're eating the way that I have them doing. They're lifting weights, they're putting on muscle mass. Personalized dosing works the best with the compounded. I highly recommend that because you can just do in between dosing. You can start a lot slower. So most of the patients that I work with, they're on microdoses for the first month. For the first 4 weeks, they're not even at the standard starting dose. When you do that, it's so much easier. You feel so much better. They don't have side effects. And even on those microdoses, we see lower inflammation. You might see loss of a couple pounds of water weight, and then that'll stop, and then maybe you won't see anything for a couple months. And then once you're titrating up to the more fat loss doses, if weight loss is even a goal, because a lot of my coaching clients are using it for autoimmunity or inflammation or heart disease risk. So it has so many potential uses. Same molecule our bodies make. We talked about this, documented GLP-1 deficiencies in patients with overweight, obesity, prediabetes, diabetes. It's bioidentical hormone replacement for the metabolism. Kind of cool. Microdosing and personalized dosing. So the goal, if you're on one of these medications, is to find your minimal effective dose to achieve whatever goals you're looking for, right? So if your goal is weight loss, the goal is to lose about 0.5 pound to 2 pounds a week, max. Because we can't lose more than 2 pounds of fat in a week. So if we're losing more than 2 pounds in a week, we're worried about losing muscle mass. And that's with or without a GLP, right? Like, people on keto will lose 5-10 pounds in a week. That's not good. You can still lose muscle mass there. So it's not the peptide that's causing muscle mass loss. It's excessively rapid weight loss from whatever source. Too high of a dose too quickly. Too much weight loss too quickly. So keeping the weight loss, and I mean 0.5 pound to 2 pounds a week on average. Like, with weight loss, it's always like you lose nothing, and then you lose 3 pounds in a week. You don't have to worry about that because that's on average you're still losing. Yeah. So don't freak out if that's a little more 1 week. And if weight loss is not a goal and you're trying to lower inflammation, you're going to look for signs like your rings are coming off. The scale hasn't changed, but your pants are fitting better. Clearer sinking, less chronic pain, puffy face. My face used to be super round. I called it drinky fat face. It was when I was in law school and I chopped my hair off too. So I had this like pumpkin head. It was super inflamed. Didn't even look like myself. Compounded forms are going to allow dose customization and more gentle titration. The brand name self-injector pens, that's going to be Ozempic and Wegovy. That's semaglutide. Semaglutide's like the generic. It's like saying acetaminophen for Tylenol, right? And then there's Mounjaro and Zepbound. Those are both tirzepatide. Mounjaro and Zepbound are the exact same medication. Mounjaro is approved for diabetes. Zepbound is approved for weight loss. With Ozempic and Wegovy, Ozempic is approved for diabetes, Wegovy for weight loss, but they're the same exact medication. It's a marketing thing, but it gets confusing. The brand name pens are so expensive. They can be thousands of dollars a month, and they are rarely covered by insurance. I always ask your doctor. Compounded forms are much less expensive. They can be from $300 to $500 a month, still expensive. So if you're going to do one of them, I recommend doing all the things so you're taking advantage of the time on the medication. The other problem with those brand name pens is they're pre-dosed. So there's no way to pick your dose, start lower, do an in-between dose. So you see a lot more side effects using those. So again, personalization with the compounded forms we'll love. And the compounded forms often go be compounded with B12 that'll help with fatigue, or B6, or it helps with nausea, different things. So sometimes they'll have something added that actually is beneficial and will make your journey on them a whole lot better. So I offer lab analysis if anybody ever wants a deeper dive, and we'll do this. I can answer questions about any other labs when we get to the Q&A part. I really specialize in hormone replacement. What are the labs you need to ask your doctor for? What are all the options? Look at all the 3 types of estradiol that I use: patch, injectable, over-the-counter cream. Yes, All hormones except testosterone are over the counter. Nobody knows that. Testosterone, injections, progesterone, like just giving you all your options. What sounds good to you? You're like, I'm never going to do an injection, so I'm going to try the testosterone cream. Great. How do you ask your doctor for it? How is the prescription written? My doctor doesn't know anything about hormone replacement. I'm like, no problem. Here's how to write the prescription. Literally, they can cut and paste. So that's what I do. Same with thyroid. What are the labs? What's a full thyroid panel? Nutrients. What is a full iron panel, for example? Doctors aren't testing that. Insulin resistance, obviously, and inflammation and infection. Those are the main sort of, as we age, categories that if we can optimize, we're going to avoid heart disease, dementia, diabetes, overweight, obesity, all the things, and keep us feeling good. And our mood and cognition, all of this affects mood and cognition. Really amazing. Peptides, okay, because I know I get asked every single time. People come in to meet with me, and the first thing they want to start with is expensive peptides. And I will give you my favorite ones, but with the caveat that these are to be added once you are metabolically optimized, because a bunch of these, like BPC 157 and TB 500 and CJC 1295 and ipamorelin, these are pro-grow. They're great for injury repair because they promote angiogenesis, blood flow. If you take those on top of a metabolic dumpster fire, which is a pro-cancerous environment, right, you run the risk of growing a potential cancer that you might have. So we want to get the metabolism optimized first. You're lifting weights, you have a good body composition, low inflammation, optimized metabolic labs, and then at the very end, add them. They're expensive. I always say, no matter how much money you have, I think everybody wants to know what's the biggest bang for my buck. If I'm going to put money towards something, I would say two things. And you don't even have to hire me. I would just say, go get your GLP-1. I can help you access that. I do work with a telemedicine company, and the prices are really good. Get GLP-1 wherever you can, but always price check with me because it's good and it's a really good company. GLP-1, spend your money on, and a personal trainer. Make you lift heavy weights at least twice a week. I was not doing it. I was shitting myself about that. And my DEXA scan was showing I was going into osteopenia. And I just was like, oh, I have a gym membership. I should go. I'm not doing it. I'm not doing it. So I hired Austin Mobile trainers. Oh my God, I love my trainer so much. She shows up at my door. It's time to lift heavy. And I was like, okay. I'm like, I can barely sit on the potty right now. But thank God, right? I'm not going to do that myself. I know myself. Some of you are more motivated than I am. I am not. I am like a curl up in the corner with my blanket. And in the 2 years I've done this, my DEXA scan, I have put on 5 pounds of muscle, lost visceral fat, gained bone density. So I'm now in the middle section of bone density instead of the lower part, which is a miracle at 52. It's wonderful. Of course, taking all my hormones helps that a lot. That's really important. But yeah, that is just amazing. Okay, so peptides. BPC, what are these? These are my favorites. BPC 157, TB 500, that's often called the Wolverine stack. That's great for injury repair. It's used a lot in sports medicine. I used that for a while for my shoulders too. GHKCU is this bright blue peptide, you guys, and it's amazing for hair, skin, and nails. So I've been doing that one. PT141, it's called bremelanotide, or the brand name is Vyleesi. This one is for women's arousal in the brain. So libido, helping in the brain, because we're brain focused for women. I would say the Cialis helps with blood flow, and it does help in that way. But PT141 helps with arousal in the brain. So you would do both to help women with, and it works for men too, but it works better for women. Men will use it. Love that one. NAD+, that's not a peptide, it's more of a supplement, but it's great for energy. You can inject that in the morning, or you can take, because these are expensive, for NAD+, you could take an oral supplement like True Niagen. That's another one that I'll do. I'll mix in so I don't have to buy as much of the injectable, which is expensive. CJC 1295, ipamorelin, that is a growth hormone releasing hormone. So as we age, our growth hormone falls and can affect just energy and recovery and all that. But again, we only add something like that pro-grow like that on top of a metabolically optimized body. Yeah, they can be expensive, difficult to source. These are great for fine tuning at the end. They are not a substitute for nutrition, metabolic healing, strength training, hormone optimization, and thyroid optimization. I would do all of that first. I mean, it's free, like changing the way you eat, that's free. Strength training, it's not that expensive. And then you can find where you land. We talked about they may promote cancer growth in metabolically damaged bodies due to angiogenesis. So build the foundation first when you're metabolically optimized. And it's just a better place to put your money. Final takeaways, you have so much control over the aging and disease processes that you've been told. We just need the right tools and to help you learn how to personalize it to you. I think what's really confusing sometimes is you hear one thing here and when this worked for your neighbor and da da da. And so a lot of what I do in my coaching practice is help you figure out what works for you. So we're going to use labs. We're going to use a continuous glucose monitor. But there's certain things like everybody should be lifting weights. That's easy, right? We don't need to eat a bunch of sugar. There's certain basic stuff. But your body wants to heal. You're not broken. Your body loves you. Just need the right roadmap that is personalized to you. And that's what I do. So thank you. Thank you. I really want your questions. This is my favorite part. I hope it was helpful to hear about your key lab markers and learning about optimal ranges and feel like you're not crazy, right? If you're not feeling great and you're like, but everything's normal, that you're not crazy and you can take control. It's really hard because a lot of us grew up with, you just do what the doctor says. And it's realizing that the conventional medical system is really not here to prevent disease or to help us optimize. It's just here to put out fires when they're already there. And so you have to become your own best advocate. And it's hard, especially for women, right? And then all these male doctors and oh, little lady, dealing with egos. And sometimes we have to fire doctors. I just fired one of my doctors because they didn't want to raise my estrogen. And I was like, my estrogen needs to be at least 250 for my shoulders to move. And they're like, oh, that's way too high. I'm like, my estrogen was 600 in my 20s. Come on. And she's like, oh, it's going to cause cancer. I'm like, this has been debunked. It's all over the news. Like, we know it doesn't cause cancer. In fact, it reduces the risk of cancer by 30%. And if women get cancer while they're on hormone replacement, their mortality risk is 40% lower. Like, and I can't with the people who are not up to date. It takes 17 years for studies to get into doctors' offices and change the way that they operate. And it's so frustrating, and I don't have time for that. I refuse. So I was like, all right, fine, I'm done with you. I'm just paying them a lot of money, and I have other providers who get it. And yeah, so anyway, I want to hear questions. Yeah. 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 Miserable. No, I think slowly this is going to change over time, but you are not alone. Any woman who has had breast cancer, doctors are so afraid of getting sued. And it's just to the point where they're actually causing harm to women because you should be able to decide your own risk tolerance when it comes to that. And most women are saying, my quality of life matters more than if I get a breast cancer recurrence. Breast cancer is 90% treatable these days. But to give up, you've got a dry vagina and your heart disease risk just skyrockets. Guess what kills most breast cancer patients? Heart disease. And they're just not up to date on the studies. And it was a very public retraction of the WHI recently, where they took the warning labels off of hormone replacement. There's been a run on estradiol. There's shortages at pharmacies. You just have to keep going and trying to find different doctors. I mean, I can't really officially recommend this, but one of my coaching clients got so desperate that she just got her hormones through telemedicine, through Defy Medical in Florida. Like, I defy you. And she just didn't tell them she had a history. She just didn't say it. She was like, this is what I need. Here's my labs. And she got all her hormones. She's like, I'm feeling great. Nobody needs to know. And she's like, I'll tell my doctor. And then what she's hoping is that she's going to tell her doctor, I'm on them. Even though you didn't want me on them, I'm on them and I'm feeling good. And my brain fog is gone. look how good my cardiovascular labs are. Look how my cholesterol's down. My inflammation's down. I feel great. I'm able to work. I'm able to have sex with my husband, blah, blah, blah. So would you write refills for these now that I'm proven to you that I'm doing so well on it? And that's what she's hoping, because when you go telemedicine, it's cash pay, so it is more expensive. But for her, she was like, for me, risk benefit is super obvious. She's well educated that hormones actually increase the chance that you will survive if you get breast cancer again. Anyway, I feel for you. You are not alone. It's really tricky. But yeah, I would just listen to your own body, and your body, your choice. Yeah. Yeah. And congratulations. Are you cancer free? Oh, yeah. 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 Because your body just dries up without hormones. It's, it's awful. Yeah. Yeah. I hear you. I hear you. Yeah. And I always say, right, like, the best information is your own data and how you feel. So get these labs done, aim for the optimal ranges, and then see how you feel and see what works for you. Get a continuous glucose monitor. You want your glucose to be between 70 and 120, even after eating. You don't even have to track. If you don't want to track food, I got so sick of tracking food. It was just exhausting. And the glucose monitor allows you to input what you're eating into the app on your phone, and you just scan it, and you'll be able to tell it what you ate. And then you'll see if you have a glucose spike over 120, you can be like, oh, wow, that was one piece of gluten-free toast. Yikes. And then maybe a toast is not my friend, and so I pull that out. But there's like a really, really nutrient-dense smoothie that I like too. It's got like berries and frozen spinach and nut butter, unsweetened protein powder, frozen avocado, all this stuff, like super nutrient dense, very low carb. If I drink that on an empty stomach, my blood sugar will go to like 200. And I was like, well, I don't want to eliminate that nutrient dense food. And then my doctor told me about ordering your food. She was like, not takeout. I was like, all right. But ordering your food, eating your fat and protein first, and then having your carbs last. So what I did was I ate my bacon and eggs first, fat and protein. And then for dessert, I had the smoothie. My blood sugar was perfect. Like, oh, this is great. So sometimes you don't need to eliminate a food, especially if you're looking at it, this is like grown up adult nutrient dense food. Sometimes you just need to reorder it. So play with that. If you get a glucose monitor, these labs, if you follow me on Instagram, I have a tutorial on how to apply the glucose monitor. If you've never done it before, it's pretty in-depth and takes you step by step, but it's super easy. Each of the little sensors lasts about 2 weeks. And if you buy a month of them, it'll send you 2 sensors. And what I like to do is just wear one for 2 weeks. And then it's like, I'll do this occasionally if I've just gone off the rails in what I'm eating. My husband and I both, like, we ate too much sugar when we were in Costa Rica. We didn't even mean to, but it just happened because we're eating out a lot. And so we put on our glucose monitors when we got back and just wore it for 2 weeks to recalibrate. And then go on your own for a while. And then save that second one for when you need it, like when you come back from Costa Rica and you're like off the rails, like that. Just to give you, because I don't know about you guys, my husband and I, we lie to ourselves about the amount of carbs we're eating sometimes. And it'll tell you immediately what your blood sugar is doing. And you're both different. Like I said, he can eat grapes, no problem. And I cannot eat grapes. So, okay, we had one more question back there. Yeah. Your EGFR is low and you're not taking creatine? Oh, interesting. Sometimes low kidney function runs in different families. And you said your blood sugar was, and they're good. And I would get tested for your HbA1c and your fasting insulin. I know, HbA1c, fasting insulin, just to see what's going on there, if there's any insulin resistance going on. But definitely want to pay attention to kidney function, because that's something that once that starts to fall, it's hard to come back from. And sometimes it's just genetic, but I would ask your doctor about it. They're not going to say anything to you about your EGFR until it falls below 60. And then it's like kidney failure. Like, all right, so we really want that EGFR over 90. What is yours like? Oh, that's great. You're doing awesome. Oh, no, that's fine. Oh, good grief. Yeah. No, you're doing awesome. Yeah.
Genetically, my whole family's very
Yeah. Yes. Yeah. So low-dose naltrexone love. I've never heard of it used in kids. I don't know why it couldn't be, but naltrexone is used in high doses for like opioid addiction. When it's compounded in very low doses, it is used for autoimmunity. So it's used often in Hashimoto's disease to lower autoimmune antibodies, but it's also anti-cancer, helps with chronic pain, helps with mood and food craving. So it's really popular. A lot of people just take it for longevity purposes. I don't know if kids can take it. I would. Yeah. Oh, wow. That's awesome. With children, I don't know. Yeah, with kids, I would start with the diet and lifestyle part and just talking about how I feel eating certain foods. And so my kids know that my dad died of Alzheimer's. They know that I'm doing all the things that I do to prevent that. And I'm just like, gosh, yeah, I just feel so much better. And both my kids are gluten free. My son, he years of allergy testing and shots. None of it told him to avoid gluten. Terrible asthma, like in and out of the hospital, nebulizers every night before he went to bed. He's a competitive swimmer and trumpet player. By the time he was 12, we'd done all these allergy shots, still terrible asthma. And I was like doing all this reading on gluten. And I was like, asthma is an inflammatory condition. What do you think about getting rid of gluten and just trying it? Y'all, within 2 weeks, he was off his asthma medications. 2 weeks. No allergist told him that. I don't know if they just don't show up. Gluten is inflammatory for everybody. Everybody. Like, you don't have to be celiac for it to do that. Yeah, he went on to break all the swim records at Austin Country Club and do Wesley Band and all the things. And still gluten-free to this day. He ordered just gluten-free pizza last night. And then my daughter, hers came with eczema, like full body eczema, and that got rid of that. So just making the connection with the kids that has nothing to do with how we look, it's how we feel. And how, what are their goals? Do you want to have better sports performance, better grades, clearer thinking, better mood, all those things? Then eating these foods and nourishing our bodies is a great way to do it. And you would also ask about D3K2 is one of the ones I recommend. You guys, I know there are a bunch of supplements back there. I think there's enough for everybody to take 2 or 3 each. D3K2 is one of my top supplements that I recommend, in addition to a multivitamin with methylated Bs, magnesium. What's the fourth one we have up there? Oh, pro-resolving mediators. This is for reducing inflammation. This is the one that I have my kids taking, and I take 2 to reduce systemic inflammation. So pro-resolving mediators, those little gel caps, it's smaller than fish oil. It's the super anti-inflammatory part of fish oil. They used to be prescription only, and they're used in the emergency room to combat cytokine storm in COVID patients. It's that powerful to lower inflammation. You take 1 capsule twice a day, just regularly. That's the pro-resolving mediators. It's back there by Life Extension. Then my doctor told me this trick, which I love, and it's worked for me every time. If you get COVID, as long as you're not having terrible cytokine storm, you don't take your pro-resolving mediators. You want some inflammatory response to kill the infection. Once you're on the recovery end, then you add it back. You take 2 capsules 3 times a day while you're recovering from COVID. This prevents long COVID, because the issue with long COVID is that a prolonged, continued inflammatory response that tends to affect our internal organs, causes like kidney damage and all of just brain long-term damage, the loss of taste and smell. I've had COVID, I don't know how many times now, and have done that every time. Never lost taste and smell, no long COVID, just got over it and was done. It was like a cold, which is really helpful. Let's see. One more question? Okay, and then we can talk more after too, because we're gonna get food, I think. And I don't know, I'm just here to chat. So because you asked about CBD something too. But well, you're still the one, and I have one more after you. Yeah. Who else? Yes.
What are your thoughts on metformin?
It can be great, you guys. I tried metformin when I had type 2, and honestly, I didn't notice any difference at all in my blood sugar or cravings or anything. But some people swear by it. We add it a lot of times to GLP-1 treatment. If somebody is plateaued on a GLP and they don't want to raise their dose, we'll add it as an adjunct. But the studies on metformin are great for longevity, for PCOS. Maybe I just wasn't on the right dose, or maybe I didn't do it long enough, or I don't know. But yeah, it's definitely worth it. It's cheap. It's inexpensive. It can maybe help minimize the GLP-1 dose. That's more expensive. So yeah, a great one. Good question. Yeah. Yeah. Yeah.
But then
Oh, inositol? Yeah.
no.
Yeah, and that's one that I take and did take. It's a supplement, and it's supposed to help with PCOS. Again, I didn't notice much difference in my labs with metformin and inositol, but it might have been that it takes time to reverse type 2 diabetes, and maybe I just didn't do it long enough, honestly. But I still take it, even though everything's optimized right now. I'll take it at night. No, I would definitely do it. It's not that expensive. And same with metformin. I'm like, bang for buck, why not? Like, it's definitely not gonna hurt anything. You can take both. Yeah, you can do GLP-1 and metformin and inositol. Yeah, they're all doing different things in the body. Yeah. Yeah, there's very few contraindications for GLP-1 because, again, we make it in our own body. So, right? People are like, oh, can I continue this? The only thing, I guess, if you're on birth control, because the way these GLP-1s work is they slow gastric emptying, so you stay fuller longer. So it does change the metabolism of certain drugs. So we say, in an abundance of caution, if you're taking the birth control pill, use a backup method if you're a young woman. But other than that, you just continue taking all your supplements and your medications as is, as long as your doctor says it's okay. Yeah. What's next? Yes. Oh, I know. Y'all. I know this is so depressing. They were telling me, I was like, y'all are serving alcohol in the morning. I was like, yeah. I was like, I'm like, this is gonna be a party. No, so one drink stops fat burning for 12 to 36 hours. So when I have coaching clients who are on GLP-1s and not losing weight, it's almost always they're counting net carbs instead of total carbs. They're eating too many carbs, but also it's alcohol. And even lowering it doesn't work because they're like, well, I'm only having 3 drinks a week. Well, yeah, Monday, Wednesday, Friday, now you're stopping fat burning all week, the one drink. And it's really hard. I had one coaching client text me last month, and she had been on GLP-1 in this program with this medical practice I've been working with, and just not losing weight, just on it, having to keep raising her dose. And I do support calls every week for all these patients. And I'm like, send me your food log. And it's also vegetarian, vegan, so hard to lose weight. It's really by definition a high carb diet. It's really hard. So I was like, culturally, she was not going to eat meat. So there's really nothing I could do there. I said, if you can get rid of alcohol and gluten, I guarantee you're going to get over this plateau and start losing weight on the GLP without having to raise your dose. Because she was like, if I raise my dose and I don't feel good, and I'm like, I know, you're stuck. Finally, it was medicine. I let it go. It was just like, she's going to make her choice, whatever. She said, oh my God, I stopped alcohol and gluten a month ago, and now I'm losing 2 pounds a week. And I was like, I know. It's just so hard, but it's like one of the top 2 inflammatory things besides the sugar. And so, yeah, she was pretty happy about it. And it takes time. Don't be too hard on yourselves. There's a whole lot of things to do in here. Just pick what's the first easiest thing to do. What's the next best thing you can do today that's better than you did yesterday? Doesn't have to be perfection. I started with alcohol because I just felt terrible when I drank. So I was like, this is easy for me to give up because I am sick of feeling terrible. So I got rid of alcohol first. And then it was a couple years later, I was like, okay, gluten is a thing. That is bad for brain health. It is universally inflammatory. It's affecting my gut health. That's where my IBS, the brain fog and all this, I got rid of that. And then years later, I haven't totally eliminated cow's dairy, but I was starting to get eye eczema and my Hashimoto's antibodies were spiking, and that can be due to cow's dairy. So I really significantly lowered it. I feel like I've gotten to this point where I can have some cheese. I really love cottage cheese. I can still have it, but it was just over a certain point. Then I start to react. So I have to be overly the alcohol. It's so hard to, I don't know, it is hard. But yeah, find something else you like. There's so many other things these days, you guys. And they're good for your brain. In that vein, if you have not read the book or watched the Netflix documentary, How to Change Your Mind, Michael Pollan wrote the book, How to Change Your Mind. It's about mushrooms and LSD and MDMA and how they're being used to boost brain function, prevent dementia, heal PTSD in our veterans, ADHD, OCD, all these kind of things. Really, really fascinating, well done book. I highly, highly recommend. And then if you're not really into diving deep in the book, Netflix documentary by the same name, just watch it. So good.
With brunch.